In alhamdulillah, wa salat wa salam ala wa rasulullah. Yes, I know we a little late today. I just got home from a doctor's appointment, but alhamdulillah, I know none of you wanted to miss this. That's why I asked Dr. McBride to not start until 6:30 because everybody's enjoying learning about the brain. How many of you are still doing the exercises? I've been trying to do them and still get it messed up. But alhamdulillah, I'm going to turn this over to Dr. McBride so he can continue to educate us as to the importance of taking care of the brain. And also, yes, we saw in action what Allah meant when he said the forelock. When we did our Metcalcitic Tafsir class yesterday, the forelock. Remember the importance of that forelock? Mm-hmm. We're going to find out. So with no further ado, I'm going to turn this over to Dr. McBride, inshallah. You can go ahead and start.
Assalamu alaikum. Today, if we could focus on, I'd like to talk about two big brain concerns that are actually increasing in society right now. I would like to talk about ADHD, and I'll focus on three bigger types. I'm not going to get into the apparently they're breaking out autism into, I think, 7 different types. Very limited to just type 1, type 2, type 3 with ADHD. And then I'll also talk about dyslexia. That can be a symptom or a syndrome by itself, if we can use that word. It can also be a symptom of ADHD and issues with the left hemisphere. And because so much of my training in these areas stems from Dr. Robert Malillo's work, I'd like to review the right and left hemisphere very generally that we talked about before, okay? What we're going to do is we're going to talk about, I'll start with the left hemisphere. And in the left hemisphere, I'm going to, and the reason I'm starting this way is because you'll see how this then reflects back or is involved with yourself or your child's behavior or family, friends, whatever the case is. So let's start with the left hemisphere. The left hemisphere emotions are happiness, surprise, and anger, and a little bit of joy also tied in with the happiness. Now, think about how that would apply to someone with ADHD or autism and angry outbursts, right? Because that's where anger resides. Most super, super strong, or if it's that much of an imbalance, because this is an imbalance. It's not I got to tell you, there's no genetic mutations in this. What you want to do is think about a term epigenetic, meaning your genes are there, whatever you inherited. And yes, there are familial ties because you inherit your potential from your parents and their parents, et cetera, et cetera, et cetera. So what you want to do is think about things turning on and turning off. Okay, they haven't tied it into any genetic mutation and incorrectability, meaning we can't do anything with it. There are things that we can do to help improve brain function and balancing. Now, with a strong left hemisphere, or we'll just talk about hemisphericity, but you've got happiness, surprise, and anger. Think about how that would tie into an angry, or you try to take your ADHD self or your ADHD child away from something or take something away from them. You are going to get happiness while they're doing it, happiness while they're achieving things, but then we're going to get surprised that you stopped them, and then an angry outburst because they did not want to finish. So we've got all three of those emotions. You also have to understand that left brain isn't super aware of anything else, of itself and its surroundings. And we'll talk about that more with the right hemisphere. The left brain is very selfish. The left brain is very unaware, as I just said. It's very detail oriented, and it also is the initiation side. Okay. The right hemisphere, on the other hand, the emotions there start with happiness and joy, but you also have all of the other emotions. You have sadness, you have disgust, you have shame, you have guilt. The reason you have these, and this is the avoidance side, the inhibition side, okay? The right brain is really important. The left brain is selfish, self involved. The right brain is social. That's what allows us to stay in the group. It's self aware as compared to selfish, right? Self aware, selfish. And that self awareness allows that person to be aware of others. Because if I'm super left brain and I am a very needs based, very short term focused attention, and we'll talk about that later also, very focused attention right here, right now, very linear driven, very needs and my needs, right? As compared to a right brain, which is very socially aware, fitting in with a group. You've got to remember, we haven't always had supermarkets. We haven't always had homes. We haven't always, and even now, we're still hardwired. Most of us are still hardwired to want to and try to fit into the group. Whether it's good or bad, we are very group and socially oriented. And the right brain is the side that helps influence that. And that's where you would have the disgust, the shame, the embarrassment, the guilt. All of these make you feel bad, self, and they also could get you ostracized from the group. If you're doing something that's shameful, you're doing something that's disgusting, all of that could get you pushed out of your society, your group. And centuries ago, and even in a lot of places today, if you don't fit in with the group, you don't survive, right? So along with that, you have, like I said, a little bit with the left brain. The left brain is very linear, very detail oriented, very short term goal oriented. The right brain, on the other hand, is very big picture oriented. So the right brain sets the goal. You want to achieve that. You want to earn that. You want to be that. Then when they're in balance, you have the right brain sets the goal, and then the left brain starts achieving it, starts doing the minute by minute, hour by hour, day by day, week by week, achieving short-term goals to hit the right brain long-term goal. So that's the hemispheres in a very general nutshell. Now let's think about, if we can, let's just jump right into ADHD. ADHD is usually an increased left, as I was using as the example earlier, a left hemisphere with a decreased right. You've got attention deficit. This is the big picture long-term goal. So now you lose that long-term focus, and this is the go side, the initiation side. So that's the hyperactive side, isn't it? So remember, if the right side is inhibition and this is initiation and they're not in balance, ADHD, attention deficit hyperactivity, then we've got no inhibition and nothing but initiation. Everything's a good idea. Everything's something I should do right now. This is what I'm going to do. And if it gets too extreme, now I'm focused on this. I'm not going to leave this till it's done. I need to finish every little step, every detail. And this might be the person that gets lost in the details and lose sight of the big picture. Again, there's a real good book for that. The Master and His Emissary, phenomenal for adults to read. Very in depth. It was a really long read for me, but it really gives you a big, gigantic picture by a European. I believe he's Irish. Anyway, the name is Ian McGilchrist. Phenomenal book. But the Master and His Emissary. The master tells the emissary what to do, and he's got the big picture: keep the city, keep the county, keep the country, keep the empire going. And then he tells all of his little emissaries what he needs to do to achieve that big picture, loving organization, community, et cetera, et cetera, et cetera. With ADHD, like I said, it's usually an increased right, decreased left. But let's talk about type 1. The first thing you want to do with ADHD is ask, what type is it? And I'm going to give you that. Type 1 is usually inattentive type, decreased. And if you remember what we talked about last week, a decreased right dorsolateral prefrontal cortex. And remember what the dorsolateral prefrontal cortex is? Well, you don't have to remember because I'm going to tell you right now. The dorsolateral prefrontal cortex is the area that makes those executive decisions, putting things together, planning, organizing, deciding whether it's the right thing to do. Okay. And then push over to the left, initiate all the right things to do, and then inhibit the things that might distract you from the right things to do. Remember, the forelock is hugely important. And the dorsolateral prefrontal cortex is that executive function, decision, planning, all of that. Okay. So you've got, and you also have hugely inattentive. Like, remember, you lose the focus, the long-term attention span, because now you're hyperactive. It's usually it's also associated with the dorsal or parietal stream, and that is very much the where is it, how is it, visual and auditory pathways. And this is important because when we come to how to improve things, we can use hearing, we can use vision, we can use all of our senses. So that's why it's very important. You can remember that. You don't have to remember that, but I'd recommend it. The dorsal stream, the where is it and how is it done, part of your senses of hearing and vision. That's type 1. Type 2. This is the hyperactive, impulsive side. This is usually a dramatically decreased right. Remember the orbital frontal cortex we talked about up here? That's closely tied to emotional, social behavior. Inhibition on the right, initiation on the left. So imagine you have no inhibition. You're blurting out, you're saying inappropriate. You don't do things socially and behaviorally to fit into your social group. So type 2 is hyperactive and impulsive. It's also about the orbital frontal cortex, about inhibiting abnormal impulsive behavior, social behavior. It also may have, if you've ever heard of habit formation, that's right behind the orbital frontal cortex in a place called the basal ganglia. That's where, if I can give you an example of how that works for all of us that tie shoes. I'm not a big fan of Velcro shoes. Number one, I think it's horrible. But no, number two, the idea is if I asked you to teach me how to tie a shoe, it'd be a nightmare. I mean, picture just for a second while I'm talking, try to figure out how you tie your shoe and how you would tell me if I say, how do you tie your shoe? Step by step, tell me. Picture that. And I can't, because it lives in your basal ganglia. That's your habit. Boom, there we go. And that's the short-term habit. It could be a long-term habit. It could be, short-term behavior, long-term behavior, driving your car to work every day. Or if you live in a city and you take the bus, you come out of your house, you come out of your apartment, you make that walk. I jump into my car, I throw the bag in the front seat, close the door, I lock the door, I turn the car on, I wait a moment or two. I check to see if any of the doctors that I follow posted after I went to bed last night. Then I'm a little warmed up. I like the engine to get going. And then I back out and I go, and then I'm at the office. Hopefully I'm trying to be a safe driver, but that's basal ganglia with long-term, a 30-minute drive, and even short-term tying my shoes. That's where habits are formed. Hugely important, because it can be physical habits, mental habits, self-talk habits, emotional habits. Imagine if you have ADHD and it's really, the right and left are really imbalanced, a very, very weak right brain and a very, very strong left brain. All the initiation, and how easy is it to form bad habits, or the children that have to do this exact pattern, or imagine OCD, Tics, that's a physical habit, a physical movement. OCD, obsessive compulsive behavior, a left brain issue. Imagine if you don't have the right side orbital frontal cortex and these things, dorsolateral prefrontal cortex, to override the initiation of bad or inappropriate habits in terms of physical, emotional, mental, all of those. Okay. And those live on the left side. Type 3, that's a combined type. That's going to be real, again, though, really decreased right, really increased left. This is also going to give you your, how would you say, most ADHD kids are going to be early learners, early readers, early writers. It's really very verbal because those are on the left side. And that's why a left deficiency, and we'll talk about it in a few minutes, is dyslexia. That could be dyslexia. You've got the left side. Some of the strengths, again, would be word finding, understanding the definition of that word. Okay. Then we go over to the right side. That's the comprehension or the big picture of the why the author decided to write in those characters, the why of the behavior of the character. It's the big picture comprehension. So early on, the kids look great. They look super smart. They read early. Oh my goodness, I've got an A student. But then what happens is the anger, the combativeness, the impatience, the surprise, the disappointment starts to develop later on in school, because as you start getting past letters and words and just the definitions, we need to get into comprehension and inference and intentions, and that's all on the right side. Okay, that's the big picture. That's self-awareness and societal awareness, as compared to the left is very self-involved, very intentional, very short-term goals. All right. And it's also where your Broca's and Wernicke's areas are. And those are your word areas. And if all these titles and things, you can certainly search them up. You can play the video slower, pause it, stop it. But all of your word finding and word usage, sentence creation, that's the left side. The big picture understanding of the paragraphs in the book are on the right side. Now, when you're looking at ADHD, it's really, really important that it can't be just in school and not at home. It can't be just at home and not at school. It has to be seen in at least two environments. It would be school, home, and social. So if a parent is having problems at home, but I've got a student that's great at everything, a good athlete, really smart, both right and left, then it's a home problem. If they do great at home, sitting there doing their homework, and they're not easily distracted, and everything within the family structure appears normal, but they've got a problem at school, then it is a school problem. It has to be seen at least in two environments, and it should also be for at least 6 months, because even the brain has growth spurts. So when one hemisphere is starting to come online really strongly, there might be some adaptations. It's like a physical growth spurt. You could be a great athlete in 5th grade, and then all of a sudden you have a gigantic growth spurt and you pick up 3, 4, 5 inches all of a sudden. So you go into 6th grade and the child can't hardly walk right. Does that make sense? So the same thing happens within your brain as, say, from conception all the way to the age of 2. So almost the first 3 years of the child's life. It's mainly right brain, learning about society, learning about its environment, learning about itself. Then the left brain kicks in. It's got a little bit of information, so now it wants to put it all together, figure it out, start learning, start applying, start talking, practicing, controlling muscle movements of the mouth, of the whole body, right? So you've got these brain growth spurts, just like you have physical body growth spurts. one of the things I'd like to point out early is literally if the child is diagnosed with ADHD, and this is general, very general, and I'm not a psychiatrist and I'm not a medical doctor. So this is very general application. Usually, if the stimulant medication is given to an ADHD child, if the medication works, stimulation, right? If the medication works, then it's probably a right brain delay because isn't that the inhibition side? If the medication works, that's the avoidance, that's the inhibition. Now we ramp that up. That balances out the overaggressive, strong left side. So that's usually an indicator. If the medication works, it's usually a right brain delay. And as a parent or a caregiver, as a teacher, behavioral therapist, all of that stuff, you can still, when we talk about solutions and helping children and adults, people with ADHD and dyslexia, you still want to realize which hemisphere am I? Think about which hemisphere am I working with, okay? And if the medication works, it's usually a right brain delay. If the medication doesn't work, it's usually a left brain delay. And we'll go into why that's so important. True ADHD almost always shows decreased right inferior and superior parietal lobes. This is why a lot of ADHD kids that I've worked with don't have good muscular control. They usually show poor posture. It's very awkward. The right side is the shoulders, the arms, the legs, the torso. That's the large muscle group control mainly. And then it's right side controls left side controls right. But the right side is the override for large muscle control. The left side of the brain, remember ADHD, if the left side is super strong, that's the fine detailed stuff. That's the early handwriting. That's the nice tight letters. Right brain, if it's an exceptionally strong right brain and a very weak left brain, when they do write, it's usually big letters. It's not as neat a handwriting. Left brains usually write very detailed, very clear. I tend to lean right, so my handwriting is kind of sloppy. But that's true ADHD. Usually shows a decrease here also because, it's a strong left and a weak right. And the superior and inferior parietal lobes for spatial awareness, along with self-awareness and spatial awareness. Now, let me ask a couple questions referencing hemisphericity, because like I said, this hemisphericity is huge in this. I'm going to ask you real straightforward. Think to yourself, answer to yourself, whatever you want to write down. Type 1, inattentive, distractible. Which hemisphere is type 1? Inattentive, easily distracted. Is that a left hemisphere deficiency or a right hemisphere deficiency? And there are no type 2 symptoms involved. Okay, to answer your question, everybody, that's going to be a left hemisphere deficiency. Because it's a left hemisphere deficiency. Yes, yeah, exactly. From Geechee, you nailed it. It's a left hemisphere deficiency. You've got to understand that the inattentive and easily distractible. Imagine if it's a super strong right brain. One of the keys to a super strong right brain is not only being self-aware, that's the basis. Right brain, you become self-aware. This is how I move my hands when babies put their hands and feet in the mouth, everything goes in the mouth, and they learn to control that. Large muscle movement, right? They can't write yet. They start with self-awareness, but that self-awareness now opens up and allows them to be aware and apply their self-awareness. That smile means happiness. That frown means anger. The down face might mean fear or anxiety, right? They may not be able to define it, but they know what it feels like because they know they're self-aware. Mirror recognition. Strong left brains usually don't have mirror recognition. Babies eventually, they love looking, they love looking at themselves. Okay. When they finally understand that mirror and that's them, they like looking at themselves. They want to look at themselves. Left brains, they don't make eye contact. They don't look at themselves. They're not even aware that that's themselves and that's them in a lot of cases. So imagine if it's inattentive and easily distractible, the left brain is not allowing them to give focused attention. The right brain is super aware of stuff, so it's also aware of its surroundings. I learned this in school. I didn't realize when I was younger that sitting in the back, away from the teacher, I always wanted to be like not seen, not heard. I really did. I was terrible. Hated public speaking. Oh my gosh. I mean, fear and anxiety like nobody's business. But what that did was that allowed that stronger right brain, because like I said, there's a test and you can actually measure how far over you lean either way. I lean a little bit. So imagine somebody walks by in the hallway. Immediately I'm looking. I hear something. People move over here in the front part of the class. I'm looking. People are whispering over there. I'm looking and paying attention. I was hyper aware of everything. So I was very easily distracted. Type 2. What side deficit would that be? Type 2. And if you want to, you can type it in because I see it on the Zoom stuff. There's Geechee. Type 2 is which side? That's going to be a right brain deficit, because remember, that's impulsive, that's hyperactive. Absolutely. That's hyperactive. That's no inhibition. Okay. That's all intention. It's that's the Australia. Oh yeah. It's definitely it's the type 2 is a right brain deficit, very impulsive, very hyperactive, very compulsive. There's no inhibition. So then type 3 is going to be what? And this you can say it's a combined problem. Type 3, as we talked about earlier, you're going to look at there's a right brain, left brain imbalance. And here you're almost always, and then there's analysis that I do. Yeah, good. It's both, because what happens is you usually have way too turned on left and deficient right. So then we have to deal with that also. Usually when I'm dealing with a patient, more children than adults, but even in adults, when I'm dealing with a patient with ADHD, I'm targeting the deficient side, the deficient hemisphere. That's the whole foundation of it. Well, and we're also doing primitive reflexes, especially in children, and we can talk about that on another occasion. You should search that up and see what primitive reflexes are. It's really cool. Most of them, all of them should be gone by 12 months. And some of them as early as 4 and 5 months. One of the really cool reflexes you can check on each other, but you cannot check it on yourself. Imagine what's one of the first early signs for a form of autism. A form of ADHD, or even more intense autism, which is really severe ADHD. Autism, one of the first signs for that is, yeah, that too. Absolutely. Because what happens is there's no muscle tone. That's a great answer. Bending body parts backwards. Hyper elasticity. There's no muscle tone, right? Because if you're typical ADHD or autistic, it's more left, very weak right. So what happens is you lose muscle tone, and you're not controlling large muscle groups. So it's horrible posture, horrible muscle tone, very little actual strength in terrible core. And that's one of the things we really work on, especially with autistic kids, but with all the ADHD. But what happens is one of the primitive reflexes is called the rooting or sucking reflex. Remember, babies they aren't taught. They already know, most of them, how to breastfeed. how to suck on stuff, bottles, their feet, you put your finger, their thumbs, they're always chewing and sucking, chewing and sucking, chewing and sucking. If they don't latch on early, then they are probably missing that rooting or sucking reflex. There's no awareness. They may not even realize they're hungry, to be honest with you. The more severe the ADHD, the more severe the autism, a lot of people lack so much self awareness that they don't even know, they don't understand thirst and hunger. But imagine all you have to do, and especially with an adult, for those of you who have someone there, or you don't have to do it right now because we're all aware of it and talking. But one of the things I always check, even on adults, and I've had adults that still have this reflex, the rooting or sucking reflex, breastfeeding reflex should be gone, is you literally stroke the cheek all the way and touch the lip. Stroke the cheek or chin, lower cheek, and touch the lip, right? And do that multiple times. A baby, a breastfeeding baby, the minute something touches their cheek, they start to turn and purse their lips. Imagine I've done that. And the last one, a gentleman, he had some brain trauma, and I ran through my primitive reflexes. That's the first thing I check is primitive reflexes when it comes to brain trauma and any functional disconnect syndromes. And he still, in his 40s, had a rooting reflex. Imagine he's got the brain function, or there's still brain function of a 1-year-old or less. And this is showing up in a 40-year-old. So think about how much interference in his adult mind, right? How much interference, since these reflexes that should be gone, they're still interfering with his normal brain function. It's still there. 40 years old, it should have been gone 39 years ago. So that's a huge issue. And let me jump into, before we get into dyslexia, I'd like to move into a little bit of autism too. And that's what I just did. One of the earliest signs of autism, extreme left hemisphere strength, is the lack of ability to latch on while feeding. This is also indicative of really other hyperactive primitive reflexes interfering with the cranial nerve control. Okay. So your cranial nerves are hugely important. There's 1 through 12. One of the big ones, number 10, is vagus, controlling all of the digestion and stuff. If things are off, if your brain stem is off, digestive disorders, heart, lung, respiration, the cranial nerves for vision and smell. Everything right there in your brain stem. If you've got issues in your brain stem, and imagine if you're 40 years old, in your 40s, and you've still got primitive reflexes, you got issues in your brain stem. You could have hyper or hypo blood pressure. Both of them are huge problems. Imagine too much blood pressure, things give out and die. Hypo, there's not enough blood flowing, things aren't functioning at their best. Now your body stresses out, gives out, and dies, right? So brain stem and primitive reflexes are really important. And like I said, that's why I check them all on brain trauma, my stroke patients, motorcycle accidents down here, and accidents in general, but any kind of brain trauma. I've got a student athlete right now. She took a hard fall and real bad concussion, and like 6 months ago, I believe it was, and she's still suffering, and she's getting better. And a lot of that is her parents are helping immensely, because there's a lot of homework to do. But let's go into autism again. Imagine what we're doing now is a lack. Think about it. If it's severe, really, really severe ADHD, if I can generalize it that way, imagine we've got a lack of social abilities. So we've got a lack of social contacts. You've got a real devout decrease in stimulation for the brain. And it's also a lack of ability, because you're not even aware of this need, right? First, yourself, you're not real super self-aware. That's the right brain. Autism is way over here. You're not aware of yourself, so you can't be aware of others. You can't build relationships. There's no need for attachment. What did we say? I think we said this before in our brain talk. Most psychopathies, psychopathologies, are left brain issues. Think about why that would be. if all you experience is happiness at getting your way, surprise when you don't, and anger when you don't, and you have no other societal awareness, it's going to be immediate, short-term self-pleasure, and the left side is pleasure. The right side is avoiding pain. The left side is usually pleasure-seeking. That's why the addictions are usually left-sided hyperactivities from drugs and alcohol, food, all those. All of those are actually abnormal habit formations, okay? And too much, right? There's no inhibition there. Imagine the autistic person that is way over there. There's no need for eye contact. I had one patient, I think I mentioned before, a young man, 15, 16 years old. His mother used to always tell him, look at the doctor when he's talking to you. And one of the reasons the young man listened to me so much is I wasn't a threat to him. I very politely, I told her, I can't remember exactly how I said it, but I'm trying to be polite because the parent is the authority figure. And I said, oh, no, that's okay. He doesn't have to look at me because he's responding immediately to everything I say. He's paying attention to me, and he's doing everything I ask him when I test him, when I ask him to do something, to show me something, to do something, lie on the table, sit up, do this, do that. He responded immediately. So I knew he was paying attention to me. And because I'm aware of my training, I realized if I made him look at me and maintain contact, he was ADHD. He was borderline. They were trying to figure out whether he was autistic or not. And I know he can't read my facial emotions. So he doesn't want to look at me because it doesn't mean anything to him. If he says something to me and I respond, he knows I'm listening. If I say something to him and he responds, I know he's listening. He didn't see the need to look. And it's really interesting. Most ADHD and most autism, balanced brain function, when the left and the right are working real close and in sync with each other, and you can lean to the left and you can lean to the right. That's most of us do. Very few of us, I think. I've never tested anyone that was 50-50 on the test. But when you're up here in what we call however we say it, there's neurodivergent and all that stuff. Let's pretend it's neuroconvergent. So when you're in that stereotypical normal stuff, neurotypical, thank you. Neurotypical. When you're neurotypical in this society, then you tend to, how would I say that? You look at the eyes and the upper face for expressions. When you're neuroatypical in this society, when you do look at someone, you usually look at the mouth to try to read emotions. And they've tested it with the eyes and the videography and things to see what people are looking at and what they scan. Neurotypical typically does the whole face, emphasis in the eyes to read emotion. Neuroatypical, almost locked completely to the lower half of the face. And one of the reasons we think that happens is because where's the voice coming from? I'm going to pay attention to where the voice is coming from. Where are the questions? All of that stuff. And they tend to be very literal too, because you're missing that big picture awareness. Now, if we can jump into dyslexia, who wants to answer the question for all of us? Dyslexia is a right brain or left brain deficit. Left, exactly. You're killing it, alhamdulillah. Dyslexia is a left brain deficit. And why? What are some of the indicators for it being a left brain deficit based on what I've already said about right brain and left brain strengths? Broca's area, word finding is left. If there's a left brain deficit, they can't find the words. Wernicke's, word definition and understanding. If they've got a left-sided left brain deficit, They don't even understand the words, or they have a hard time hearing your words and learning them. But think about it. Also, with left brain, with dyslexia, excuse me, and a left brain deficit. Dyslexia, think about, I'm going to read this to you. It is a language-based disability, a language-based disability. It's not just a reading deficit. There are so many different reasons for a reading deficit. Imagine, believe it or not, imagine your cerebellum, the back part here. Everybody talks about that's what they test with. Alhamdulillah, Muslims don't have to worry about it. We don't have to worry about being pulled over and failing a drunk test, right? But your cerebellum, smooth, coordinated movement. We know now that not only is the cerebellum important for smooth, coordinated movement, it's also important for smooth, coordinated thoughts. It's also important for smooth, coordinated emotions, all three of those. So imagine if your smooth, coordinated movement is off and you're not controlling your eyes right. Some people, and we know them as adults, their eyes are off center. So imagine as I'm reading across on a sentence in a book, and one eye is a little out more than the other. When I try to focus on the word, imagine I'm reading the one word, my other eye is registering two words down, or even if it's off just a couple of letters. Now that word doesn't make sense to me at all. And now I've got to go back. Then your brain has to figure out which eye to believe. Imagine if they're up or down. One eye, and it's no exaggeration. Imagine one eye is up, the other one is down. One eye is paying attention to the one sentence, the other one is at the sentence you already read or the next sentence coming in, and your brain has to sort that stuff out. You could spend forever trying to coordinate that. Now imagine you're just learning how to read and you're dyslexic. Oh my God, you're going to hate reading. You've trained it in. It's hard for me. I can't do it. I don't want to do it. I'm frustrated. And with dyslexia being predominantly a left brain issue, imagine how upset you are. That's weak. It's a weak left brain. So now your right brain, you're very self-aware. You know the kids, you're worried about yourself. You know that you're hyper aware of how the other people feel. You know that you're the guy next to you doesn't like it when the teacher asks you to read out loud because it takes you forever. You're embarrassed, you're self-conscious, and sad, right? Embarrassment, that's all right brain emotion. With dyslexia, huge issue. And this is one of the solutions to it. But dyslexia and the left side, that's also hugely important for speaking. Because if you have dyslexia, you have a hard time learning letters, combining letters to make words, and combining words to make sentences. You've got a whole, and the left brain, remember? Big picture, big muscle movement, detailed muscle movement, and motor planning. Motor planning is on the left-hand side. So now think about how hard it is. One of the hardest things to do is talk correctly. You've got to control, talk about fine motor movement. You're moving your lips, you're moving your tongue, you're breathing, you're using your voice, you're tying in your lungs, you're getting brain function to tell all of this, bring it together. One part says, okay, this is what we're going to say. The other part says, okay, can we say it? Have we said it before? Your basal ganglia goes in and says, oh yeah, I've got a pattern for that. Your cerebellum makes it real nice and smooth. Then it comes back up front and you initiate the movement. Imagine coordinating all of that, and you've got a weak left hemisphere, which is motor planning. Now you can't plan that movement correctly. You can't even sound them out. You can't learn to sound it out. Dyslexia, even after they learn to speak, it's still that problem in motor planning. So it's a nightmare for reading, writing, and speaking. And dyslexics usually with a weak left brain, they have a diminished ability for focused attention, right? Remember I gave you my example when I used to sit in the back of the room when I was in school, high school and stuff. In chiropractic school, they knew I was up front. I was one of the first 3 rows. I always sat and I tried to dead center that thing. And once in a while I was late to class. If I ever got trapped in the back, it was a nightmare of a class for me. So you can imagine my motivation to sit up front. I was driven to sit up front because this material was hard. It was important. This is what I want to do. This is what I know I'm going to do. That was the big picture. My left brain took over, made sure I was early for class, made sure I was ready to take notes. I was right up front. Okay. Dyslexics, they don't have weak left brain. You may want to be at class early, but you can't narrowly focus. You forget, you lose track of time. If you don't have a strong left brain, you usually don't have a strong time frame either. Dyslexia, also hugely important. Like I said, think about it. It's usually remember how the right brain and ADHD, that's usually, a lot of times that'll involve the parietal lobe up here. The dyslexia usually involves the temporal lobe and word processing problems. This will include, like I said, sounding words out. If you can't teach yourself what that letter, what that word sounds like, how are you going to understand to follow directions and to listen well? That'll be awful for you too, if it's diminished enough, if you're literally diagnosed as dyslexic. Dyslexics, left brain activity, or focused attention is left brain activity. Attention focused problem without hyperactivity, usually an underactive left brain. Now, some solutions. 721, excellent. Some solutions for this. And this is something that could be important for all of us. It's not just dyslexia. It's not just autism. It's not just ADHD. It's not just Alzheimer's. But there's some really good research, particularly targeting Alzheimer's and autism, believe it or not, where if you decrease, for all of us, if you decrease your caloric intake, you decrease the amount of food you take in. That's why all these different diets, when you decrease caloric intake, not just a certain type of food, but the amount of calories. That's why Ramadan is so beneficial for us. You decrease your caloric intake and you increase the body and the brain, especially, in a really cool word called autophagy, autophagy, meaning eating and cleaning yourself. So what happens is your cells that do that, when you're not eating and you're not dealing with food breakdown and the blood flow isn't digestive and all that stuff, your energy, rather than breaking food down and making sure it's safe and your immune system paying attention to your digestive system, now when you're not digesting and breaking down new stuff and there's no new threats, you actually clean up and improve brain function. And then you move into like a ketosis diet and ketones and using body fat in the brain. There's a lot of research showing that brain tissue, brain cells actually work better on ketones than they do carbohydrates. But it's really cool because just for autophagy or that cleaning part, it'll improve brain function and get rid of the waste products that are up there. Hugely important in Alzheimer's and autism, but that's for all of us, literally. And then there's different research. You can talk about 12 hours, 16 hours. Literally during Ramadan, we're doing it for what? 28, 29, I'm sorry, 29, 30. And we're going all day long, sunrise to sunset. Another solution with type 1 ADHD, you go along with stimulating the frontal lobe, and we went over that last week, and the hemisphericity, the whole side, the right side. You also really want to target the right parietal lobe. When I'm talking about parietal lobe, that lobe is going to be spatial awareness. So you can actually use both the right temporal lobe and the right parietal lobe. A really cool test with a partner or a treatment, a really cool treatment is to stimulate the right parietal lobe, meaning I'm going to use my left hand. Okay, I'm going to use this. You could, as a partner, husband, spouse, parent, friend, literally what you do is you might want to, let me keep it in the camera. I'm going to snap the fingers, right? And of course, I'm cheating because I know where my hand is. Snap the finger touch, snap the finger touch, snap the finger touch, snap the finger touch, right? You train it in. All right. Now the other person, the patient, will close their eyes. You're snapping your fingers, you touch, snap, touch, snap, touch, snap, touch, move it, right? And now you're tying in sense of sound and sense of spatial awareness. So you're stimulating two of the biggest, the parietal and temporal, and of course you've got half the occiput on that side, but you've got that. You've got that when we're doing the right side, right? You're stimulating the right. I'm sorry. Yes, I'm doing it right. You're stimulating the right parietal lobe, the right temporal lobe, and you're doing with as simple as sound. As simple as sound, you're doing that right side because you're using your left hand. In my case, I've got both hands up, but I'm using my left hand to stimulate the right side if it's that stereotypical decreased right hemisphere. With the right hemisphere, you can also really cool, especially with younger children, because they love this stuff. You can use the colors. Again, we just did sound, we did spatial awareness and visual memory with the reaching. You can also do vision itself. The right hemisphere loves or is more activated with the colors blue, green, and indigo. So you could give your child blue, green, or indigo play glasses. You could emphasize blue, green shirts. You could do blue, green bed sheets, pillowcases. You could have blue, green colors in any artwork that you have. These are really, all of this is why I'm mentioning it, is it's affordable stuff. I use a lot of, I'll do a lot of laser things. I have the laser that I use on myself and patients. Really cool. And that's why, and it's red and infrared. And I won't go into the definition of laser and why this is not just an LED. But if you were to order an LED light, left brain. I was typing earlier and I was writing, so I wanted to go over my left hemisphere. So what I did was I have a stand right here next to my workstation, and I'll literally, there we go. The stand, it's out here and it's lighting up the whole left side of my head. And I'm thinking, I'm typing, I'm correcting some things. So I want to do a lot of word finding, right? And a lot of word understanding. And then when I'm being more creative, I'm going to be over here. And I want to develop new ideas, put things together. Back here is your parietal, temporal, occipital area. So we're including all the three areas of that side. And over it, like I said, this is understanding the big picture. When I'm actually typing, what's the big picture I'm trying to achieve? And then the details, what words, paragraphs, sentences am I going to create to achieve that? The same thing can be done with LED lighting. I have a couple of panels. My children have, my mother has one. And the ranges, if you're going to think about LED lights, you want to use red and infrared, and the range is between 6 and 900 nanometers. It's not important. You don't have to worry about it. And with everything else, the contraindications there are don't use it with a pregnant person and don't use it with a person with cancer, because you don't want the energy that it's providing to speed up a cancer. You don't want to give cancer cells more energy, and you don't want to speed up the development of the fetus. Okay. But I use a lot of red light, if I mention that. And now, if for those of you that remember from last week, I like contrast programs or contrast games. And again, we've got the finger game, right? Very clearly, if you weren't here last week, this is both initiation and inhibition, really important for the orbital frontal cortex. And especially with an ADHD patient, it really, research shows that it tends to light up the right side more with the inhibition and following the rules. what you're going to do, for those of you who weren't here last week, and for those of you who were, I won't make a big deal about it. I'll go fast. The parent or the husband, the wife, whoever, what you're going to do is, I would take two hands, and you're going to take two hands. Now you're going to match me and my right hand, my left hand. The hands opposite. You don't have to go your right and your left. The hands opposite of mine. I raise up one finger, you raise up two. I raise up two fingers, you raise up one. So I raise up one, you raise up two. I raise up two, you raise up one. Make sense? And then after you do that, like I said, I go here. You're supposed to do what you do. You're supposed to do what you do, right? Okay. Now, once you do that, like I said, my one, your two, my two, your one. This time, we can make it simple. My one, your two. My two, your nothing. Changing rules. That's where strengthening the right side, particularly the orbital frontal cortex, and it also tie into controlling your emotions better. The orbital frontal cortex is really important to controlling the emotion centers that are right behind it. So what you're going to do is inhibit, right? I do one, you do two. I do two, you don't do anything. So I do two, you, yep. I do one, you do. I 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 do. Okay, so that's how that's done. The other, what we call go, no-go game or contrast game, is the card grab. Like I said, what you're going to do, I prefer to take out the face cards. You grab the hearts and the spades, clubs and spades, clubs and diamonds. You're going to grab two different colors, shuffle them together. And then every time I flip a card, and we like to do this for time at our house to see how good we are. You flip for color. Every time it's right, you grab it with your left hand, however, whichever hand you want to. Red, grab with the left. Black, grab with the right, and just flip the colors, right? And you just grab based on, and in this case, it was left and red, right and black. Boom, 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 boom. That's your base time. Now, the new rule to train in inhibition again in the right orbital frontal cortex is to grab based on even or odd. And if you want to keep the aces, consider that one. Even or odd. No matter what the color is, now you got to inhibit and override your first rule. Flip the card. It's a two. Grab it with your right hand. It's a three. Grab it with your left hand. It's a six. Grab it with your right. It's an eight. Grab it with your right. It's a nine. Grab it with your left. Does that make sense? So these are both great, and depending on how much discipline the child has, and you can't get upset. It's keep it short. The minute the frustration levels start to ramp up, and they happen in our house because we tend to be very competitive. The minute the frustration levels start to ramp up, just stop. Make it a fun game and let the child do it to you. All right? Or the adult that we're training in, right?
I prefer actually for the youth people. That is better. All the youth. Yeah, seriously, the youth is very, the benefits are just listening. Me, myself, yes, but the youth is very important, especially for the people high school kids.
Isn't it? It really
agree with you 100%.
It's so important to, that's why my patients and family and friends, I use the term train it in, train it out a lot. Because if I can jump back to the very beginning, with ADHD, type 1, 2, 3, with dyslexia, with whatever we're talking about, heart attack, strokes, I deal with a lot of brain trauma, right? What you do is you train out the bad habits and you train in the good habits. I remind my patients all the time, oh, it's so hard, I'm older, it's this, that, and the other thing. The idea is, especially my new patients, I tell them, one of the most simple examples I can give you is the fact that before you started coming here, you did not even know how to get here. Now You know exactly how long it's going to take you. You know what routes you're going to take. If the traffic, what time of day you change your routes, you have literally, that's proof in your head that you learned something new. It involved traffic. It involved relationships with other people. It involved changing your schedule, creating new pathways. Every time you learn something new, you've proven to yourself that you can create a new pathway. You just have to train it in. Your brain will believe whatever you tell it. If you tell your brain you can't learn it, you can't do it, your brain believes you. If you tell your brain you can do it and you can learn it, your brain believes you. Another example, you guys, I don't like public movies very much. I don't like the crowds. Again, maybe it's my right brain. But the idea is you go to a movie. Nowadays, you pay what? $5, $7, $10. You're sitting there with friends. You made these plans. You get there. You're in a theater. You should be in a real comfortable chair. Your brain believes everything you tell it. You start watching that movie, boom, the guy comes out. You jump, you get scared. You got scared by a movie. That guy, that girl, that monster was not a threat. You're at a movie, but your brain believes what you tell it, and especially what you see. That's why all those guys, they can do those tricks, and you get caught up watching something, and your brain believes more of what you see. But you can literally, you trained it in to believe the director and believe the movie. And now when something happens, you get happy, you get sad, you get scared, and it's just a movie, but you trained it in to believe it. Let's see.
And Brother
Yes,
Abdurrahman, something very
absolutely.
important. A lot of people in this way, they can memorize the Quran easy, regardless of the age.
Yeah, and especially with, and as the Imam said earlier, especially with children.
Yes.
You've got to realize children have a higher energy level, faster adaptability. So the earlier we get to, like I gave you the example of autism, the earlier we start working with children and paying attention to the primitive reflexes, for example. We don't have to do anything else. Let's just make sure the primitive reflexes, I test for 10. Make sure the primitive reflexes are good. If that baby's not latching on, we already know there's a problem. One of the ways you can stimulate a baby, a patient mentioned, we were talking about something, and she happened to say that however it led into it, she told me her baby doesn't latch on real well. And I said, wow, now I know what it was. She asked me about my brain. I have brain charts. And she asked me about that. She said, oh, this is really interesting. And I said, yeah, and I usually use the rooting or sucking reflex because everybody knows babies already know how to eat, right? And she said, oh, our son, and she had him with her. She said, our son doesn't, he has a hard time latching on. I was like, oh, no way. Okay, let's try this. I said, do you mind? And I literally, the first couple didn't do anything. He hardly even did anything. About the third, fourth stroke, he started turning his head, and we didn't teach him how to do anything. All we did was stimulate the reflex. On her next visit, a couple days later, 2 days later, she comes in and she says, my husband and I do this all the time, and he has started latching on like he's supposed to. Babies will not override their reflexes. That's why they're trained, why they're there. Allah has blessed us with all this hard wiring to start with. We just have to train it correctly. And in this case, we just stimulated that reflex until that baby couldn't resist. And now he's latching on, and they don't have a problem with that baby anymore. So imagine now a 2-year-old, a 3-year-old, a 5-year-old, a late walker, horrible posture, horrible muscle tone. These are just some examples. We start working with kids, the sooner the better. The sooner the better. And especially with that real strong left drive, real weak right hemisphere, a lot of activities, a lot of not super stressful, but muscular activities. Like I used to play when I was growing up. The sister knows when we were growing up when we're in our 60s, and some of you are in your 70s and 80s. You were outside all the time. You actually did stuff. That stuff trained your brain. We used to play red light, yellow light, green light. We used to have all these go, no go games. We trained in the inhibition. We trained in the go. We trained in the stop. We played sports. What you're going to do is, if we jump back to the beginning where I mentioned hemisphericity, if we have a left brain weakness or a right brain weakness, okay, type 1, 2, or 3, what you can do is something as simple around the house. I use, like I said, I love using my laser, and I'll do other stuff like I'm typing or writing, and I'm stimulating word find, word search, so the laser gets absorbed by those cells. What you can do is you can use all of your senses. Think about, let me start right here with vision. Vision, like I said, you can use colors. If you want to write this down, write it down. The right brain loves or is more activated. The right brain is more activated, not loves. The right brain is more activated by blue, green, and indigo. The left brain now, red, orange, and yellow. So those colors you can use to stimulate the hemispheres. Smell. The smell is the one thing that doesn't cross over. Vision does. So if I want to stimulate the left hemisphere with vision, I'm going to kind of do things a little. I prefer when you're training and talking, you can tell a child what you're doing. Have them look straight ahead, but look out of the right corner of their eyes. That stimulates left. Left corner of their eyes stimulates right. And then you use the colors. You can do shapes. You can say what is the number, what is the letter, what's the shape, all of that stuff. Smell, that stays on the same side. So if you're trying to stimulate the right brain, that likes strong, almost unpleasant odors. Again, safety. If it smells something, it's really looking, even smelling, to make sure it's safe. If something smells rotten, it's not going to go over there, right? And then the left brain, and again, make sure the oils or whatever you're using doesn't irritate the skin. But like I mentioned before, I put it right on my mustache. The left brain, ipsilateral, remember, with smell, that does not cross over. Ipsilateral, fruits, pleasant smells, your favorite smell. And smells are really cool because they also stimulate memory and associate smells more strongly. They have a strong emotional context also. So using smells to stimulate brain function is even more important than like light touch or something. Then we're going to go into hearing crosses. So whatever the favorite sound, if you're listening to Quran and you're listening to things,
I'm here.
If you're listening to these sounds, if you want to stimulate the left brain, put it in the right ear because that sound crosses over. You want to stimulate the right brain, put it in the left ear. Put it in both ears to stimulate the whole brain, right? But that's something, if you're targeting one hemisphere, one weakness, take it one half at a time. Pretend you're a person that had strokes on both sides. Well, one day target a lot, or not one day, but one session of the day, target just the left side and do left hemisphere. The second session, target the right hemisphere and do just the right.
There is no parking. The whole area here is always very far away from the house.
Parking.
Sorry, brother.
Now we've got touch, vibration, muscle stimulation. Remember, again, hemisphericity, the right brain is very aware of something happens on the left. The right brain can usually take it over because that gets the big picture, and that's also more self-aware of insides and out. So with the right brain, that tends to respond to everything. But to target it, again, the right brain, I'm going to stimulate. You could have a $40 TENS unit, put it on the leg, put it on the back, bigger muscles, just very light to touch, to sensation, the patient, you feel it. And that'll cross over, and your brain is constantly aware of that new stimulation. If you're talking to someone, spouses, if you want to stimulate more of a big picture thing, sit on your spouse's left side, rub the shoulder, put your hand on the leg, hold hands, hold their left hand, and stimulate that side of their body while you talk. And again, it's going to go in the left ear, cross over the right brain. If you want to get detail oriented, talk to the right side and stimulate the right side, tap, touch, hold the right hand, that kind of thing. And then muscular activity. If I want to stimulate, real simple, I love basketball. I think basketball is really easy to do. I like it with my stroke victims in particular, once they can use both limbs. But imagine if you've had a left side, if you've got a right brain weakness, I want you to just simply dribble the ball, whatever speed you can, with the right hand. You know how complicated that is, and you can look at it while you do it. I don't mind, but you're going to dribble. Now you're using your parietal lobe, muscle control, spatial relationship. Where's the ball? How far away is it from my hand? Sound, you pick up the rhythm of the movement. You've got vision, you've got muscular control, you've got your cerebellum involved. You're involving your whole left side. Your whole right side when you're doing left-sided basketball dribbling. And then you switch it over, right? And you're doing the same thing to the other side. You can also do what you see basketball players, crossover dribbles, nice and slow. Now you're tying in both hemispheres together. And that's something, literally any kind of ball. We have a lot of basketballs here at the house. That was one of my kids' favorite sports. You know, I've got a 6'5" son, a 6'4" son, a 5'9" daughter, and a 5'8" daughter. And the 5'8" daughter was a
My God, how tall are you? That's hereditary. How tall are you?
There's a lot of, and research shows the more physical activity a child has, and adults, the more stimulation and actual brain function and learning they do, especially kids. But it's never too late with adults, because like I said, I have my stroke patients at the office. We have a video of a patient came in 6 months in. She was out of the wheelchair, off the walker, off the cane, walking across the lobby, dribbling a basketball, doing crossovers. And so much of that was her and her husband and the work they did, the homework they did at home. Do we have any questions?
Yes. First of all, how tall are you? That's hereditary. They must have two tall parents. My family's tall like that too.
No. I'm only 6'2".
That's still tall. That's good. That's good. Because my family's like that too. Everybody's 6 feet, 6'5",
right.
6'5", 6'4", 6'3", 2", all that stuff. Yeah. Okay, here's a couple of questions here. One of the sisters wants to know, what can you do to help stimulate a child to walking? A child is over the age of 1 and doesn't want to walk. How can you stimulate them to get them to walking?
Man, sister, that is a great
By the way, this is from my daughter.
Okay, literally tell her or ask her, or you can think about, I'll say it to you. The idea is, did the baby crawl a lot? That's when we talk about walking, the first thing they have to do to be good walkers is be good crawlers. It's not a shuffling. I'll show you the developmental progress. The first thing babies should be doing, okay? The first thing is literally an army crawl. They haven't figured out how to tie top and bottom muscle control yet. So they usually crawl and pull themselves and crawl and pull themselves. And that's when they go over onto their tummy. Now they're holding themselves up. Now they're starting to move, and that's easy to control. They can see it. They figure that out first. Then they learn to go faster by crawling on hands and knees. Now, not only are they doing right arm, left brain, left arm, right brain, but now they're doing top and bottom, and they may look weird at first. They're kind of alligator crawl or animal crawl, and then alligator crawl. Then they should start coordinating right arm, left leg, left arm, right leg. And that teaches them that gets the muscular control to stabilize their spine because they're up on all fours, right?
Right.
And now they are coordinating the arm movement and the leg movement across the body while they're still stable. If they are not walking yet, do not move them to walking until you've moved through those phases. Like, get the baby, honestly, sister, if you want to, get down on the floor and
show her how to crawl. She's doing the alligator crawl. She just perfected the alligator crawl.
Okay, then now, how would I say? It's literally hands and knees, mom or you, or get older siblings to do hands and knees.
Okay.
Do hands and knees over and over. You don't want them walking until they have perfected
crawling. Yes.
Cross crawl, what we call cross crawl.
Yes.
And believe it or not, for adults, it will help you. I don't know whether you need the help, but I need all the math skills help I can get.
Me too.
Oh, yeah, really cool research showed that the more cross crawling, if you cross crawl 20 minutes a day, if you test before and then after, I can't remember the time frame, it was a month, I think, or several weeks to a month, you can improve your math skills. And at the end of this research project, they actually improved their math skills by 20%, however they measured it. So cross crawling, along with body control, improve their math skill function. And again, detailed movement that makes sense. The math centers are on this side. Detailed movement is on this side. Math also requires spatial relationships, so you're using your big muscles while you cross crawl. It really, cross crawling or crawling normally really ties in a lot of brain function. So you don't want a child walking and if they're already walking, but they're horrible at it, clumsy kids, start crawling with them again and make it a family thing so they don't feel bad. If the child is old enough, what we do is we call it, it's know that I'm sensitive with my kids. It's called dumping. You hold the child, and if they are using their arm, then what happens is if you hold the baby, especially if they're old enough to crawl, you hold the baby and then the legs, and you have your hand under their chest, and you act like you're going to dump them forward. You tip them forward. They almost always lock their arms down in front of them. Mm-hmm. Now what you do is do it so they can reach the floor, and they'll get their hands on the floor. Now you hold them and walk them like you're going to do what we call a wheelbarrow race. Remember those when we were kids? We did wheelbarrow races. That was part of our phys ed day or whatever we did in elementary school. I remember that. And you can teach them to go nice and slow. Then you can go faster. You can get them to go backwards a little bit. You can really teach the arm part of cross crawl, dump, and then walk them forward just a little bit and train them to go longer and longer and praise them crazy. There's no, when you're trying to train this stuff in and out, you stop when you know they're about to fail. If they start to fail, don't push them through it because they're already frustrated. And it's a lot of praise. Okay, you don't ignore bad behavior, and but the crawling and the walking, you have to cross crawl first for brain development, and then now they've got the muscle tone and all the strength to hold themselves upright because they've been using them safely with all fours. Now they can train in and get up on all twos, get up on both feet, the twos. Does that make sense, sister?
Yes. I'm going to try that with her.
It's got to be crawling first.
That makes sense.
Crawling. It's the whole spine, it's a heck of a core workout.
Yes.
A great core workout. What they do, these personal trainers, they use a lot of what they call bear crawling, where the person's on their hands and their feet at the same time. Mm-hmm. Phenomenal core workout. And again, like I said, brain and math skill.
Okay, here's another question. One of the brothers here is asking, he said this was a very informative explanation of the brain. He said, I am writing my thesis paper and it's taken me forever because I go through a block where I don't want to write. He said, if I try that LED light, will that help to stimulate my thoughts better?
I use the LED a lot. I can say probably, you know what else I do? Believe it or not, I can bring it right here. You'll notice that I don't wear watches. I don't wear jewelry. I'm what you consider self-diagnosed, but I fit all the criteria. I'm hypertactile, in the sense that, or hypersensitive, not hypertactile. That means you usually like to touch a lot. I'm hypersensitive to touch, and I don't like jewelry. But the more I learn about the brain, and because I'm so aware of touch, I started wearing. I've got this ring that I literally today, when I was finalizing the lecture, organizing the thoughts, getting it from the big picture, which I did. Then I put more structure on it, right? Where's the structure? Focused attention, concentration, minimize my distractions. It happens to fit my ring finger, and it fits my middle finger. So I'm so aware of that's such a stimulation, my right side into my left brain, my focused attention. I sat down this morning from 7 to 9 after Fajr, 7:30 to 9:30, when I sat down at the computer and just reviewed and started. I pulled up all the quotes and all the information I wanted to use. I did that for a straight 2 hours. And this, like I said, I told my kids, if they ever want to give me gifts, give me those little cool beads or whatever you wear on a string. And depending on what I'm trying to do, now, if I was trying to get a big picture and I want to get ideas, I'm going to put stimulation on the left side of my body. And I'm still typing and doing my thing. And then if I want to be more detail oriented and I want to focus in on it, I put it on my right side. And that's what I'm going to do. I said, if you ever want to give me a gift, get me a cheap watch. All I want to do is feel the rub, right? And you can literally do that. And like I said, my laser is on the whole time. I just can't recommend any of the things off of Amazon because I don't know how good they are. The panels I actually bought, if you want to, look into a company called Platinum LED. Platinum LED. And I go with the cheaper versions. They're still kind of pricey. They've got 2 lines. One is Biomax. The other one is just Bio. 300, 600, and I don't want to say 9. That's too easy. Anyway, they've got these panels, and I buy from the Bio side, and literally you can set it and light up. Like if I'm not feeling well, I'll not just the brain brother, but I'll literally lie it on my torso. And I'm a big fan of on skin, so that the material, because even laser light, because these are cold lasers, right? The LEDs are just LED light. They're not even as focused as what's considered laser. LED, I'll literally lie the panel on me and light up to strengthen my immune system. After a good workout, it's true that these athletes are now using lights before, during, and after. But if you're going to do, like I said, pretend you're trying to put ideas together. You're trying to get the initial stuff done. What's the big picture? I just want to write and get started. You write down every idea you can get. Then switch it over to the left side and have the light hit that left side. And I'm a big fan, especially to incorporating the frontal lobes. So I'll have mine is usually angled this way, or where my stand is, it's straight to the side. But I'm a big fan of trying to incorporate the frontal lobes also because of how important they are. And like the frontal eye field, I'm looking at my computer focused. Frontal eye field helps focus down on attention. So I'm looking at it. I'm looking at whatever, if you're doing a paper, review and read your sources over and over and over again. What stimulated that idea? The minute that idea comes in while you're looking at it, oh my gosh, type it down, share. I start with quotes and facts, then I flesh it out with sentences and intermingling ideas.
I have a question too for myself.
I think that red light is great. Red and infrared, both. Red, infrared.
I have a question too, just from what you're speaking about. You know, in my office where I'm always teaching and streaming, I have
Mhm.
LED lights. I'm a writer too. I'm writing a novel. You know, vampires,
Yeah.
werewolves. You know, I'm a real writer. I'm
The
not.
scary stuff.
Yeah, that stuff. But anyway, every time I come in here and do my classes with this I keep the LED lights on,
Yeah.
and that's when I get all these crazy ideas. You know, I'm going to do this in the next chapter. I'm going to do that. So could it be that these LED lights I have that's circling all over the room, and I turn them on, could that be stimulating me in my thoughts? You know,
You could literally be, especially if there's any colors to it.
they're all colored. They're
There you go.
red, they're
Think
yellow,
about
they're
what we-
green.
There you go. What did you just named all the colors I just talked about stimulating both sides, didn't you?
Yeah, and that's what this is. They're red,
No
yellow,
lie.
green, and blue.
You, sister, you did red, yellow, orange, red, orange, yellow. That's how I prefer to go with it. But picture whichever colors you want to do, red, orange, and yellow. Detail, focused attention. Oh my goodness. Word finding, word understanding. Then if you've got blue, green, and indigo,
Yes,
you know, that deep purple stuff.
that's what I
however you
have on
describe
the
it.
other ones too. Yeah.
Then that's your work, that's your right side, that's your big picture, your ideas are coming from. And then the red, yellow, and orange take over, and that's how the exact words and the phrases and the background and the house and the monster jumps out and all the stuff I don't like.
Every time I do my classes, I get these ideas. Yeah, so now I see these lights that my granddaughter left, these LED lights that go crazy, they're stimulating me. Oh,
I gotta tell you, I think the it's more for you, it's a color scheme, because most of those lights are not going to be in and that's how important color is.
Yes.
You're probably not even in the say the 600 to 900 nanometer range. Very, very important. So, well, again, Geechee, if you're going to go with that, with the blue, your favorite colors, like I said, trying to influence your brain. Exactly. It's one of those things. I don't use a lot of color. I'm more of a right brain. I'm more of a physical guy. And like I said, being hypersensitive to touch, this kind of stuff, like here's my whole left brain. Then I move over and I got to put get some new ideas and left brain, right brain stuff, left body stimulation. It's really the colors. Like I said, the colors are huge, because remember my example about scary movies?
Yes.
Your vision is the great override of almost everything. That's why when I test patients in the office, for example, balance, how important is vision? And why I say this, because of color influence. Your vision, I'll say, okay, stand with your hands on your hips, feet close together, depending on how stable they are. Feet close together might put some people at risk, right? If they're good with feet close together, then I'll have them stand on one leg. Some people can do it, some people can't. And then if they can, I'll ask them to close their eyes. Now they fall all over the place. And I'm right there, but they'll start leaning in their body languages and their hands come off. It's a fail. Your vision, picture as a chiropractor, along with a functional neurology, but the chiropractor right now. If these vertebrae, your hips are off, your spine, things are off a little bit. That's what I'm working on. Got a little head tilt, this and that. Imagine when your eyes are open, your eyes are telling your brain, I'm looking straight ahead, you're level, don't fall, 1 foot on the floor. I'm almost always asked, why is that so hard? You close your eyes, now my eyes are closed. Your brain only gets feedback from the spine, from the vertebra, from the hips being level or unlevel. Say your foot is flat and you lift this foot up. So your foot, you've lost your arch. So your foot is telling your brain you're leaning to the left. Your eyes are closed. So that's not an override. So your brain has to believe your foot, even though you're standing straight. Your foot's saying we're not straight, we're leaning to the left. So your brain says, okay, foot, I believe you. And your brain tells the body to go that way, and you start to fall, and you don't know why. Your proprioceptors, they measure position in space and time. They tell your brain all the time where my fingers are. I can't see them. My ears, proprioception. You know where you are. Your brain will believe those if your vision is taken out of the picture. Does that make sense? So now if your brain's going to believe your eyes, stimulate your eyes with all that color, red, orange, yellow, blue, green, indigo. Oh my gosh, stimulate the heck out of yourself with just that. Just so that you know, my favorite color is blue.
Mashallah. May Allah bless you for that. Anyone else in Zoom? Go ahead, take the mic, guys. I know y'all typing, but can y'all take the mic so the people on the social media can hear what you're asking? Oh, y'all went dead on us.
Excellent. That's fine.
Yeah.
Again, one of the big takeaways from today for yourselves, your kids, anyone, like I said, I deal with the brain trauma, strokes, physical trauma from accidents or injuries, emotional trauma. I can't do that. Like I said, I can do weekend or 2-day intensives. I use a facility and I can do 2-day intensives. But the emotional trauma, like PTSD, that tends to be a right brain thing. That takes a lot more. That takes more time than just the weekend intensive. That'd be a week-long intensive.
Okay, we have another question here. Okay, I'll ask it, Timothy. And by the way, I'll create a group for you guys so I can see I can't see what all of you are typing unless I am a what you call it, administrator in your group. So I'm going to make a special group for the Sunnah follower new shahadas on Facebook. So that way I can see all of you are typing. Okay, so I'm sorry he said he had to join. Okay, he's on Twitter so I can see this. Okay, he says, go ahead, type it. He said, wait, I got a question. Go ahead, type it.
But use all of your senses. Like I said, touch, muscle activity is the most important brain stimulation. You've got smell, you've got vision, you've got hearing, all of that stuff crosses over. Smell stays on the same side. You've got touch, all of that stuff, and especially movement. Get yourself a ball and dribble. If you've got horrible balance, another activity, believe it or not, is just squeezing a ball. Or if you have a fidget toy, whatever these things are, that stimulates that cerebellum on the same side.
He typed, will you cover the stem too, to see how a person's stem, because this happened with someone close to me. Their stem died, but they said the person would never come back the same, but the person is able to move, able to talk, and is being rehabilitated. So can you talk more also about the stem?
What is that? STIM?
STEM, the brain.
Oh, brain stem.
Yeah.
Sorry. Hugely important. Brain stem. You've got 12 cranial nerves. I don't know your patient, your friend, but and it's also hugely important. You've got all these you've got all these pathways. I mean, imagine the brain can't get to the body except through the brain stem, right? And the body can't get to the brain except through the brain stem. If your brain stem is not functioning correctly, and after a trauma, whether it's a stroke or a motorcycle accident, I think I mentioned that to you, where the young man was thrown, landed on his head, his helmet blew up, bang, bang, bang down the street. Those primitive reflexes come back. If you can find someone that deals with primitive reflexes to get rid of those, and like I said, I do 10. I focus on these 10. They're the bigger 10, Dr. Malillo and my training and all that stuff. And then there are also 12 cranial nerves. You can look them up. That way I don't have to run through them. But you've got 12 cranial nerves. You've got the vision cranial nerves. You've got the eyeball movement cranial nerves. You've got olfaction is the first three, 2 eyes and a smell. You've got all these different ways you can stimulate the brain stem and control it. And then you can also stimulate each side. They may have more of a right-sided problem, say, and you can see it in their eye movement. So then cover one eye and stimulate that eye and try to improve that function, right? With movement or just vision for discerning things. You can get the eyes to work together by helping the cerebellum by doing what we call pencil push-ups or finger push-ups. They focus on your finger and you do that. Now we're dealing with vision and oculomotor. Like I said, the smell stays ipsilateral on the brain. Your smell senses. That's the second. Olfaction. No, olfaction is number one. Then you got 2 and 3. 4 is trigeminal. 5 is facial sensation. That's just touch. You can just stroke the person's face and you can do temperature. I suggest just warm and just cold, not super hot. Temperature, you can do light touch. 6, lateral eye movement. So have them do this, have them do that, have them do this, have them do that. You're stimulating cranial nerve 6, and there's a whole bunch of little activities that all these nerves do also. 7 is facial muscular control. So then you have them make faces, raise the eyebrows, smile, grit your teeth, frown, all that stuff. So you can stimulate all 12 of the nerves. Number 8 is not abducens, vestibular auditory. So you've got hearing and balance. Number 8. Number 9 is hypoglossal. Wait. Number 9 is spinal accessory. Let me think about that. Number 9, I think it's hypoglossal tongue movement. 10 is vagus, and that's emotional control, digestion. You can just massage the stomach, the whole cavity to stimulate the intestines. Right on the edge of the opening to your ear. You'll see people, I think I've mentioned it before. You put a Q-tip in there and some kids just lose their minds. They love it so much. Their eyes roll back, all that silly looking stuff. That stimulates your vagus nerve. That's the largest cranial nerve in your body. That by itself changes, that influences heart rate, respiration, ramps down your emotions, ramps up your calm, improves your digestion. 11, I believe, is spinal accessory, shoulder shrugs. 12 is hypoglossal.
Okay, well, mashallah,
Anyway, so there's 12 spinal nerves in your brainstem. You can stimulate your brainstem. Then you pick a side. I think trigeminal is the only one that comes out same side. Not trigeminal, trochlear. Sorry, eye movement. Trigeminal is most of them are opposite sides, and you can search it up just to make sure I said it correctly. Trochlear comes out ipsilateral to control eye stuff. Yes, it's brainstem stuff.
Yeah, well, inshallah. Okay, go ahead. I'm sorry. Go ahead.
Yeah.
I have a question.
Yeah.
I have had PTSD, and a lot of it caused a lot of negative thoughts.
Yeah.
What I do to just out the blue, I just started to when the negative thoughts come, I move my eyes back and forth from the left to the right, and it'll help me. It's okay, and it'll help me to refocus. What is that?
Oh, that's
what am I doing?
Yeah, there's a lot. I think the initials are, I can't remember the words. I think the initials are EMDR. Okay. You could search that up, but think about what I just said about cranial nerve 6, abducens or abduction, meaning you're moving your eyes to the left, you're moving your eyes to the right. You're actually stimulating the brain stem in the area of, it's just really cool. You're doing a lot. Then you're also focusing down on something, your frontal eye field, and then the fact that you're doing it intentionally is really stimulating to the left brain. You're focusing on it. And what happens is really important with PTSD. Pretend it's like, if I can use this, like in the movies, you have soldiers, particularly in Vietnam, right? And more so now, but in the movies, it was they come back from Vietnam, they got PTSD, and you're running around in the jungles, and holy cow, I have relatives that were there. You imagine you're a year in the jungle and you survive, and people didn't, and all those firefights and blah 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 blah, or trauma, like repetitive trauma here. Growing up being a minority, growing up being a female, I shouldn't say minority, a non-white, or maybe it's an abusive household or whatever it is. There's a lot of traumas here, and that trains things in. Imagine if you're hyper on the right, hugely important for PTSD, hugely important. You don't have a time frame on the right. So you could have a trigger. Vietnam, you hear a crash, you hear and then that started a firefight that your best friend died right next to you. Then it wasn't you, it was your friend. You don't have a time frame. And there's no logic to it. It's an emotional memory. You're doing something intentional. And what you're doing, the lateral eye movement, and there's a lot of little things that go with that. But you have now moved, you're on purpose, intentionally taking, even though it's only your eyes, you're taking a physical activity and you're focusing on it. So now you override the right side. You literally have, it's brilliant, sister. I'm glad you did that. You're overriding and you're bringing this intentional activity, and this is intentional, right? And it's also eye movement, focused, frontal eye field, focused attention, because you're concentrating on it. And you're putting it's right now. Now your brain says, oh, there's no reason to be worried about this because it's not happening. One of the big things, and whether it's you or not, but one of the big things is the lack of time frame and the lack of how do you say, the even though it was a real emotional memory, it's not right now. The trigger may have been there, but now you can override the trigger by doing your horizontal eye movement, and that's you've got to keep doing that. I mean, absolutely. And then there's a whole bunch of other things that you can do. Like I said, stimulate the left brain more, because the right brain tends to be more PTSD. You can do left brain, like I said, right-handed activities while you're doing it. Maybe you even include the finger to make it more of a left brain and pull it even faster away from your right brain. You could even follow your finger side to side, or do it with just your eyes, or follow your finger. A right brain activity, just squeezing a ball. Left brain.
I used to, because I also had struggle with learning, I would doodle and then read. And that's been like a big help. Also, like doing certain things.
Sister, you sound like you're so right brain dominant. I mean, you're doodling. That's and then you struggled with learning. That is so typically your superhero strength, because I consider like ADHD, you got a superpower, whatever that is. You maybe. I'm just guessing because we've never met. The idea is you're doodling, your PTSD, so there's a lot of emotional effect there. You have to be creative and fidget a little bit before you can focus down, so you have to burn it off, and then you can focus attention. Then you have to burn it off again, then you can focus. It really sounds like you're right brain dominant, sister. And
yeah, that's how I am too. I'm right brain too. Yeah, that's me.
Then what you want to do is stimulate the left brain, and again, you can add things like colors, maybe like orange and yellow is really cool. Red tends to have emotional context to it. Orange and yellow tends to be a softer, more subtle for the left brain. What else? You can wear, like I said, with jewelry to stimulate the left brain. You can put something on, wear jewelry on this side, not for show, but for health. Wear the bracelets that move a little bit. It really sounds like you have a very strong strength. It really is a strength in the right brain. And all we have to do is train your left brain to balance it out, so that rather than just being an emotional response, now it becomes logical again.
Yeah, that's what's happening. It's a lot of emotional response due to all different kinds of trauma.
Yes.
So I'm trying to get away from that, and so the Quran has helped me with it a lot.
Oh, absolutely.
Just learning certain things from the Quran recently as a new convert.
What city are you in?
I'm in New Jersey.
Oh, you're way up there.
In Phillipsburg, yeah.
Gotcha. Yeah, I don't know anybody up there. You know who's up there though, although my guy, Robert Malillo, Dr. Malillo is in Long Island and Manhattan. It's kind of pricey though. But you know what you can do? Get his book. I don't have it right here. Look at, and we've got he has a lot of left brain, right brain activities in there. The book is called Disconnected Kids, and the most recent version is edition 3. When I bought it in August, it just came out for print. It was $17 on Amazon. Get that book, sister, and look at left brain stimulating activities as a guess, based on how you're describing things. That's a great book. Real easy to understand. He actually wrote it for parents and families that can't get to him or to one of us.
Exactly. Mashallah. This has been a wonderful class. And inshallah, Dr. McBride, everybody's asking, will you continue this next week too? There's so much that we're learning.
There's a lot of brain stuff. Is there a brain topic? Or should I just come up with it and I'll figure it out?
Well, Timothy was asking, can you talk more and do a lecture on that STEM?
Oh, brainstem.
That's what he really wants.
We could talk.
He wants, and I'm gonna be honest. I'll be interested in that too, because my nephew had brainstem damage. I think a couple other people in this website too. So that would be a good topic.
I could do something with put together a 12 cranial nerves thing.
Yeah, because that's what Timothy's typing here. Yeah,
absolutely, Timothy. Great idea. Thank you, mashallah. I'll put together a brainstem talk, and then Sister Juanita, you should, if you're here, inshallah. Like I said, you're really activating. Like I said, that 6th cranial nerve, and you'll be able to see 1, 2, 3, and 4 are in one area of the brain. 5, 6, 7, and 8 are in another. 9, 10, 11, and 12 are in the lower brain stem, and how these different areas are really cool. How they influence brain activity and brain function, and how they influence each other.
Yeah, this would be good. Yeah, we have another class. We have Dr. Sheikh Saud coming in 10 minutes, guys. So we're going to wrap this up. And inshallah, we're going to continue this next week. I know a lot of you got... Huh? Okay, make it quick because we got Sheikh Saud. Yeah, go ahead.
Yeah. Dr. McBride, I know you held a wand. You got a LED wand.
A laser.
A laser. I have
actually a laser.
Okay. Hold it up again, because I have an LED light that's similar to that.
Yeah.
I also have a one that actually vibrates and throws out the red colors. I've had these for like a year and a half and didn't really know the benefits of them.
Oh, huge.
So now I'm using them.
Huge benefits. It's literally immune system, and it gives the cells more. Your cells have something called chromophores or chromatophores. They light sensitive cells. They pull the light, they make energy with it like chloroform for a plant, and they give the cells more energy, more ATP to heal, grow, repair, cleanse itself, whatever.
MashaAllah. Thank you.
Okay, guys, I'm gonna load us out because I got Sheikh Saud on here. Okay, inshallah, I'll be logging in about 5 minutes. Y'all look at the stream for Sheikh Saud's class on implementing the Quran. Get ready to happen in 5 minutes. So, subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Okay, yeah, we can.